There is a saying in neurology that sounds terrifying, but is actually the most important thing you'll ever hear. Time is brain. Every single minute a stroke goes untreated, the average patient loses nearly 2 million brain cells. That is a staggering number. But here's the part that keeps me up at night. It's the fact that for so many people, the clock didn't start ticking when they collapsed. It started days, sometimes even weeks before, with a whisper, a subtle sign that was brushed off as just stress or a weird migraine or maybe I ate something bad. The tragedy of stroke isn't just the event itself, it's the missed opportunity to stop it when it was just a warning. Today, I want to help you hear those whispers so you never have to face the scream of a life-changing event. If this kind of deep dive into your health resonates with you and you want to keep learning how to protect yourself and your loved ones, please take a second to click that subscribe button and the little bell. It really helps us build this community of health conscious people. And just so we are on the same page, everything I'm sharing with you today is grounded in serious medical research from top institutions. And I've listed all those sources in the description below so you can verify everything for yourself. I want you to feel empowered by facts, not fear. Now, let's change the way we look at a stroke. We tend to think of it as a lightning strike, something that comes out of nowhere, but biologically, a stroke is often more like a termite infestation in the foundation of a house. The termites, which in this case are things like cholesterol, plaque, and high blood pressure, have been chewing away at the structure for years. The collapse feels sudden, but the damage was cumulative. The body often knows the structure is getting weak, and it tries to tell you. Research actually suggests that nearly half of all stroke patients experience prodromal symptoms, warning signs, in the days leading up to the main event. One of the most dangerous myths we need to bust right now is that a stroke always looks like the classic drooping face or slurred speech. Yes, those are critical signs of a massive event, but the early warnings, especially those that happen in the back of the brain, are much sneakier. Take, for example, a headache. I'm not talking about your garden variety tension headache after a long day at work, and talking about what we call a sentinel headache. This isn't a slow build. It is often described as a thunderclap. Imagine someone hitting a gong inside your head, 0 to 10 pain in seconds. This thunderclap pain can happen days or even weeks before a major hemorrhage. It's caused by a tiny leak in a blood vessel, a literal drop of blood irritating the sensitive covering of the brain. It's a warning leak. If you experience a headache that feels completely different from your normal pattern, especially if it hits maximum intensity instantly, that is not the time to take a nap. That is your body pulling the fire alarm, moving away from pain. So let's talk about something that seems almost comical, but is actually dead serious. Hiccups. We've all had hiccups, and usually they're just annoying. But there is a specific type of stroke affecting the brainstem, the control center for your automatic functions, that can trigger intractable hiccups. These aren't hiccups that go away after a glass of water. These are relentless, painful hiccups that can last for days, often accompanied by nausea or a feeling of needing to vomit. The reason this happens is that the stroke is irritating the nerves in the medulla, the part of the brainstem that controls breathing, and the diaphragm. If someone, suddenly develops hiccups that just won't stop, especially if they also feel a bit dizzy or have some numbness in the face, do not assume it's indigestion. It's a classic, yet frequently missed, sign of posterior circulation ischemia. It's your brainstem struggling to maintain order. And speaking of the brainstem and the back of the brain, we have to talk about balance. We often dismiss dizziness as dehydration or maybe an inner ear infection, but there's a very distinct sensation called the seasick stroke. This isn't just feeling a little lightheaded. This is vertigo, the hallucination of movement. You feel like the room is spinning violently around you, or like you're on a boat in a storm, even when you're sitting perfectly still. And the key giveaway here is what doctors call truncal ataxia. That's a fancy way of saying you can't control your trunk, your core. If you feel dizzy and you literally cannot sit up straight or walk without holding onto a wall, that is a red flag. An inner ear infection might make you dizzy, but you can usually still walk. If your world is spinning and your legs refuse to cooperate, your cerebellum, the part of the brain that coordinates movement, might be starving for oxygen. Now, let's shift to how you see the world. Quite literally, vision changes are another massive warning sign that people run to the eye doctor for instead of the ER. But your eyes are just the camera lenses. Your brain is the processor. If the processor gets glitchy, the picture goes bad. You might experience a sudden curtain falling over one eye, painless and temporary. That's a clot passing through the retinal artery. Or You might lose vision on the same side of both eyes, like someone put tape over the left half of your glasses. This is tricky because people will often say, my left eye is blurry, but if you cover your left eye, you still can't see the left side of the room with your right eye. That means the problem isn't in the eye. It's deep in the occipital lobe of your brain. Sudden double vision is another one. If you start seeing two of everything, it suggests the muscles controlling your eyes are no longer getting the right signals from the brainstem. Never wait and see with vision loss. I want to touch on a symptom that is particularly common in women and is sadly frequently misdiagnosed. It's sudden, overwhelming fatigue, MLAs. We live in a tired society. We are all exhausted, but this is different. This is a power down fatigue. You might feel heavy, brain fogged, or just generally unwell in a way you can't explain. Research shows that women are more likely to present with these non-traditional symptoms: shortness of breath, confusion, unresponsiveness, or just extreme weakness, rather than the classic crushing chest pain or paralysis. Because these symptoms look like the flu or exhaustion, women are often sent home or delay going to the hospital. If you are a woman or you love one, please know that a sudden crash in energy accompanied by mental confusion is a vascular emergency until proven otherwise. And then there is the symptom that mimics intoxication or even madness: sudden confusion or difficulty understanding speech. And this can be subtle. Maybe you're talking to someone and their sentences start coming out like a word salad, fluent but meaningless. Or maybe they suddenly can't understand a simple instruction like lift your arm. This is often caused by a small clot affecting the language centers of the brain. The person might not look physically ill. They might be walking around fine, but their software has crashed. Family members often think, oh, grandpa is just getting older, or they suspect a urinary tract infection or medication side effect. But age doesn't make you lose language instantly. Stroke does. If someone suddenly changes their personality or cognitive ability, check the clock. We also need to talk about the dead limb. We know about weakness, but sometimes it starts as just sensation, a feeling of numbness, tingling, or heaviness in one arm or leg. It might feel like you slept on it funny, but you've been awake for hours. Or you might feel like your arm doesn't quite belong to you, a phenomenon called neglect. This is often a sign of a blockage in the deep structures of the brain, like the thalamus, which relays sensory information. Even if you can still move the arm, if it feels wrong or numb, that sensory disconnect is a sign that the wiring is fraying. Don't shake it off. Test it. Can you feel a pinprick the same on both sides? Is the heaviness persistent? Now, I've mentioned a few times that these symptoms can be temporary. This brings us to the most critical concept of all, the TIA, or transient ischemic attack. People call this a mini stroke, but I really dislike that term because there is nothing mini about the risk it represents. A TIA is a stroke that fixes itself before permanent damage happens. The clot lodged, the symptoms started, but then the body dissolved the clot, or it moved along and blood flow returned. Think of a TIA like a flickering light bulb. The bulb isn't broken yet, but the wiring is faulty. If you ignore the flickering, the fire is coming. The risk of a massive stroke is highest in the first 48 hours after a TIA. If your arm goes numb for 10 minutes and then gets better, you didn't dodge a bullet. You are standing in the path of the gun. You need to go to the hospital immediately to find out why that clot formed and prevent the big one. And so putting this all together, what does this mean for you? It means we need to expand our radar. The FAST acronym, face, arms, speech, time, is great, but it's not enough. We need to be B fast, B for balance, watch for that sudden vertigo, E for eyes, watch for vision loss, and then face, arms, speech time. And beyond that, trust your intuition. You live in your body every day. You know what your baseline feels like. If you experience a sudden violent deviation from your normal, whether it's pain, vision, balance, or just a profound sense that something is wrong, don't talk yourself out of it. Don't apologize for bothering the doctors. I promise you, we would rather tell you it's nothing than tell your family you were too late. The good news is that the brain is incredibly resilient. Even if a stroke happens, we have amazing treatments now. Clot-busting drugs, mechanical clot retrievers, but they all depend on time. And even after injury, the brain has neuroplasticity. It can rewire itself, route around the damage, and relearn. There is so much hope in stroke recovery, but the best stroke is the one we prevent. By listening to these whispers, the hiccups, the headaches, the dizziness, You are taking control of your destiny. You are becoming the guardian of your own brain. Thank you for spending this time with me. If you found this helpful, please share it with someone you love. It might just save a life. Check the description for the full list of medical sources like the American Stroke Association and the Mayo Clinic. Stay vigilant, stay healthy, and I'll see you in the next video.